Hi, welcome to another episode of Talking with Docs. I'm Dr. Brad Wiening.
And I'm Dr. Paul Zalzal.
Paul, today we have a very interesting topic. It's the top 3, not top 5, reasons or mistakes that people make after hip replacement.
Okay, so you've had a total hip replacement. Here's our video on what not to do.
Yes. Why are there only 3 and not 5 like the knee?
It's just, the thing about hip replacement is it's just easier to recover from than a total knee replacement.
Sorry, hip replacement patients, if you've been telling everybody that's as hard as a knee, you're wrong.
Okay, I'm not saying it's easy and it's a breeze to, like I should have said that differently. I should have said it's not as hard to recover from than a total knee replacement.
Would totally agree with you. Typically less pain
and
less physio. It's not as physio intense. It has more focused physio.
A little physio, but not as much.
Okay, so top 3 reasons. What's the number one reason or number one mistake that you think people make when they have a hip replacement?
They go home and fall.
Okay.
I mean, that's an obvious one, but it's a big mistake. Don't fall.
It's funny that you say that because I tell all my patients, hey, whatever you do, just don't fall. It's probably the only way that you can wreck it.
Yeah.
And in the last 15 years, I've had, a handful of people who have fallen and had a fracture, a dislocation. And they have told me that while they're falling, the only thing they can hear is me saying, just whatever you do, don't fall.
Yeah. And you're sitting there looking at your phone or your tablet and you're watching this video going, what's this idiot saying, don't fall? A fall is an accident. I can't help it if I fall. But you can, because you can try and control the environment around you to prevent a fall.
Yeah, so you can only do your best.
Do your best. Watch out for the rugs. Watch out for ice. Watch out for slippery floors. Just really be vigilant, and in that way you might be able to reduce the chance of falling.
Okay, I think that's a good number 1. So my number 2 is not doing proper physio and prehab. We had talked about this in the knee video, but depending on the approach, but there's specific muscles around your hip that are really, really important, called your abductors, that we want them really strong before, and we definitely want them strong afterwards.
It's a good one. And the funny thing about that one is it's a mistake you can make before you have the surgery.
Even before.
Okay?
Don't make that mistake.
Don't make that mistake unless you have a time machine.
Okay. Very good. Okay, so that's 2. Do you have a number 3?
Yeah. I think number 3 is putting your hip into an extreme wonky position. Okay, what I mean by wonky and extreme is hyperflex, so really like for some reason, trying to get your knee to your forehead in the immediate post-op period, or for some reason trying to do like a full-on twist around and pivot around that hip, because the tissues around that hip replacement are trying to heal. You have to let them heal before you put the hip in an extreme position, because you might pop it out,
which is obviously very bad, and the acute solution to that is popping it back in, but it certainly can have long-term, potentially permanent ramifications that could lead to more surgery or a suboptimal outcome.
Exactly. So hip dislocation, you want to try and avoid that. And this is kind of an evolving thing, right? Years ago we had these very rigid total hip precautions.
Don't even talk about the hip. Don't look at it. Just everybody hope it doesn't dislocate.
Just keep your toe pointed straight ahead. So then over the years we've relaxed those because hip replacements have become more inherently stable. We're using larger head sizes for various reasons, and we have another video on hip dislocation. They're becoming more stable, so we're relaxing those precautions, but we still need you to be careful and just.
Yeah, thankfully hip dislocation has become much more common. When we were
much less common.
Much less common,
yeah.
When we were training, you used to see dislocated hips on a regular basis, but now thankfully it's pretty infrequent.
Yeah.
Not impossible, but that's what we tell people. You got to be careful, especially early on. You got to be really careful.
Yeah. So there it is. So let's review 3 mistakes you can make when you have a total hip replacement.
Number 1,
fall. Don't fall.
Number 2, do your exercises before and after. Get ready for your hip replacement and then really give it the best chance afterwards.
And 3, don't dislocate. Avoid those wonky positions, extreme ranges of motion that might put you at risk for dislocation.
No early yoga. So if you like this video, please like it, subscribe to our channel, and keep your hips safe.
And remember, you are in charge of your own health.
We'll see you next time.